Hey, what's going on, everybody? Welcome to the Freedom to Flourish podcast. We've got a huge episode for you today, number 90. We're getting real close to 100, Dr. Joel. It's coming along.
I
We're
know.
going to do something real special. But today, as far as it goes for, I guess, subject matter of the podcast, it's just going to be a continuation of what we were chatting about last week. Just talking about the rest of those unique cases that we've had that have come into the office that we feel are probably pretty cool just to chat about. So, Dr. Joel, I know you added a couple things to your list and are kind of looking through some things to come up with a few more. We'll see if we have time for more stuff, but I mean, geez, we can always just talk forever on these things. So we'll see what we get through. So I believe last time I chatted about patient with hormone issues and migraines after concussions, as well as the lady who had a mold issue and had a fracture in her back that wouldn't heal. So the other ones that we're hopefully going to have time to get into is a couple different things. So chronic issues, stomach issues, nausea, vomiting, dizziness, all kinds of stuff that this kid had when he came in here. Kid, he was 21, but came in and had missed out on 6th grade, had to repeat it because he missed so much school because of it. So it had been going on for a long time, and he's totally fine. And then left-sided tingling or just weird neurologic symptoms tied to the gallbladder, and then a plantar fasciitis issue that was tied to diaphragm dysfunction. So those are the three I'm hoping to get to. Dr. Joel, 1, how are you doing today? 2, what things are your big ones that you're hoping to get to today?
Cool. Love it. Doing well here. Doing well. Excited to keep going on this mini series here. So yeah, last time, just quick recap from the part 1, talked about the patient that had the tongue fatigue after getting sick with some viruses. Talked about the one gentleman that came in. He had a heart attack before. He felt like he had 1 week to live. And we jumped into that stuff with the heart. We talked about a hamstring injury that had taken forever to heal. And then the salt, the electrolytes helped that thing heal really quickly. We talked about the one patient, the 14-year-old that had lupus nephritis, which is not an exciting condition. We've got all of those labs reversed, and she's doing really well. There's a couple cases that I didn't get to, which was a patient that had thyroid nodules that we've actually, via ultrasound, they're gone, which is really cool. So we'll get into that one a little bit. And then one patient that had significant pain in her lower area, in her bladder area, terrible pain, and she had blood in her urine as well. I didn't get into that one, so we'll get into that one today. I'll talk about a gentleman that had 3 bouts of diarrhea every morning before he went to work, in his 20s, and he wasn't even like looking for a doctor to come in. It was actually his mom that was like, hey, you need to see this guy, and then he came in. So we'll talk about that, and then I'll share maybe 1 or 2 stories about just working with athletes and really how the body is able to heal much faster than we might think. And we'll talk about a gentleman, an athlete, a senior in high school that came in. He had a grade 2 ankle sprain about 36 hours prior. He didn't necessarily need crutches, but he was not doing anything more than walking in, and he was literally, I'm not even kidding you, he was running by the end of the visit. So really, really cool stuff. So we'll get into that and maybe a couple other things that might pop up.
Very cool.
Sweet.
Well, let's get into it. So I guess I'll start us off. So the first one I'd like to talk about, 21-year-old kid. Sorry to the 21-year-olds out there who think they're adults. I really think that, total side note, that there are some people that never truly mature, and there are other people that they could be like 18, 19, 20, 21, and they act like full-blown adults. So I'm just kidding when I say that.
No, it's true. There's a saying that I've heard that is, you can have to shave daily but not be a man. You know what I mean?
I haven't heard that one.
Yeah, you can shave. You can have to shave daily but not be a man.
We will often just joke around about our frontal lobes being developed or not in the office here. And Part of what I think pushes the frontal lobe to fully develop is adult responsibilities, like having children or a mortgage or just adult bills.
When you're kind of
Um,
forced into it, you think?
you're kind of forced into it. Yeah, 100%. But then there's people who are forced into it that they never really get beyond that. So I don't know. Totally besides the point. Anyway,
Yeah.
this patient, he was great. He was super fun to have in the office. But him and his mom, they set up a phone call to chat about stuff. And he was like, "Yeah, I'll just get these insane bouts of dizziness that just show up super randomly. Can't really predict when it's going to happen, how it's going to happen, what's going to happen. I throw up almost every single time. It's like I eat and I usually throw up. It's just this terrible thing that's been going on for years and years and years. And when him and his mom finally came into the office, we got chatting about things, and I was like, "All right, well, how long has this really been going on?" And he goes, "Well, it's been going on as long as I can remember." And his mom was like, "Well, yeah, it's been happening a long time." And then they just shared, he had to go through sixth grade twice. I think that came up when, like, we were talking about how old he is, and like he was going into his junior year of college or something. And I was like, "You're 21. You're kind of old for your grade." He goes, "Oh yeah, didn't mention. I did sixth grade twice because of this health issue that I have." And I'm like, "Man, that's terrible. That sucks that he's been dealing with it this long." It's amazing. Sometimes when people come into the office that they're like, "Yeah, I've been dealing with this forever," and it's like, I'm just now getting a call, and um, they've been to gastroenterologists and all kinds of other docs, but it's like they'll take this hiatus on trying to figure things out because nobody can help, and that just kind of tugs on my heartstrings a little, because I'm just like, why is it so difficult for people to find people to help them?
Yeah.
It's I think that the area that I live in here in Arkansas is a bit sparse in regards to people who are able to help with complex conditions like that, and more of the natural side of things. So anyway, so we got into treating things, and whenever there's chronic heartburn or nausea or loss of appetite or vomiting, things like that, more often than not, you're going to find some sort of upper GI organ that's really seriously irritated. It's going to be gallbladder, it's going to be pancreas, it's going to be stomach, if not all of the above. And you got to kind of sift through and figure out which one's truly the priority and the primary problem. And oftentimes you're going to find that you need to treat them all because they'll all show up as being a primary issue at a visit. And so with him, we ended up finding pancreas issues, gallbladder issues, all the things. I believe there ended up being some sort of dysbiosis going on in the larger small intestine as well. But really what ended up being the biggest driver of dysfunction was it's honestly not terribly uncommon. So if you have issues related to blood sugar, or if you have issues where you just feel nauseous, loss of appetite, can't lose weight, all kinds of things, I will every couple months, like maybe once a month, once every 2 to 3 months, something like that. I'll have patients that come in and they have a full-blown autoimmune reaction, a Th17 reaction to dairy that will test off the pancreas using the systems healthcare technique that we use here in the office. And they get rid of dairy, and it's like it just changes their life. I have had patients who they're full-blown diabetics. They get rid of dairy and their A1C drops to not even pre-diabetic range, but below that. I've had patients that they're like, "Man, I just always feel like puffy, bloated. I just can't lose any weight." And their blood sugar is a mess. They have heartburn, all sorts of upper GI issues. And all of a sudden, we get rid of dairy and have them take some sort of natural antihistamine like Camu or quercetin. And all of a sudden, they're like, "Oh my God, I dropped 15 pounds like overnight. It's great."
Wow.
Um,
It's like their body lets go of all the inflammation, or what?
I'm sorry, what was that?
It's like their body lets go of all the inflammation, or
Yeah, that's one of those things that I'm still trying to wrap my head around. And with this guy, I'm going to talk about another thing that I'm still kind of hawing about that I'd like to hear your opinions on. But yeah, it's almost like it clogs up the drain for getting rid of inflammation and any sort of excess fluid. And it just wreaks. It's one of those things that wreaks havoc on your body in a lot more ways than people understand, without a lot of symptoms most of the time.
yeah.
So I've seen, I think, more people than not who have this issue testing, they have some sort of elusive problem that's really difficult to pin down. And it almost never ends up being like, oh, I have issues right after I eat some sort of dairy, And that's why they're like, man, I can't figure out if it's food. I can't figure out if it's this or that.
Right.
And then when they're like, hey, I quit eating it for like a month before and it didn't do anything. Well, there's two sides of the coin with the immune system. There's the side where you need to eliminate the stimulus for problems, whether that's a food for having an allergic reaction, or whether it's an infection and you do herbs to kill it off or whatever it is. But there's always byproducts of that if you don't clear those out, it's going to keep the immune system hyperreactive and not doing its job to fight off infections and all those things. And so whenever you have an allergic reaction, typically what you have to do is remove the stimulus, but you also should be doing some sort of natural antihistamine to clear out the excess histamines and also calm the histamine response, dampen the Th2 side of the immune system. Because if you don't, it just doesn't go as smooth, and it can just take forever to actually get the immune system calmed down naturally. Some people, their immune system just gets stuck, ramped up, and that will happen. And so you need to do something to calm it down. But anyway, so he had the pancreas issue with the dairy, and then he also had some gallbladder dysfunction, and both in combination were testing to be irritating his vagus nerve. They were causing all sorts of weird brain muscle indicators to show up. And as we kind of progress through treatment, typically what we'll see, and I'd be interested to hear if this is kind of what you find with when you're testing patients. Day one, we'll normally find that very broad indicators of dysfunction will just test as being a problem. So if you have a vagus nerve issue, it'll just test as being a problem. If you have an adrenal issue, it'll just test as being a problem. Some sort of weird nervous system issue, brain, will test as being a problem. But as we progress through, it's like day one, it'll just test. And then from there, day two, it won't. But if we provoke it with like dairy or stress hormones or other various offenders, it'll then come back to the surface. And so that's why we will gather a lot of indicators with testing so we can track progress with that along the way. And then also if something's, quote, not testing by itself and somebody's still having the same symptoms, we can then reference those indicators to try to pull something out. Because if they still have symptoms, but it improved based off of what we worked through, in my opinion, that makes sense that it would still be tied to that. We just need to figure out what the next step is and how to pull that issue out to confirm what's going on and what nutrients we need to do to fix it. But with that being said, he had all of these basically central nervous system weirdness indicators going on, where brain is dysfunctional, vagus nerve, those are two big ones that will often be tied to dizziness and a lot of weird nervous system stuff. And so I'm like, okay, cool. Well, we'll roll with this. We'll see what those are pointing to. And it went to gallbladder and pancreas. We pretty quickly found the pancreas problem, ended up giving him some sort of antihistamine. Off the gallbladder, there was, I believe, insulin, maybe acetaldehyde, some things like that. But either way, what I was alluding to previously with, some other things that I'm kind of trying to think through and how this affects so much. But the gallbladder with insulin problems, in the last couple months, I have seen so many people with gallbladder dysfunction due to insulin issues that cause things like dizziness, heart rate variability problems, heart palpitations, migraines, and then this other patient that I was talking about with just the left-sided weird neuro symptoms, like tingling and just feeling off. Literally draw a line down her entire body, gallbladder with insulin. So why is it that the gallbladder causes such weird dysautonomic symptoms? So I'm trying to gather my thoughts on that. But either way, this kid, he had that going on, and then he had this significant, very, very, very significant dairy problem off the pancreas. And in combination, as we worked through those, started detoxifying the insulin, started addressing the hormone detox pathways to get rid of it, and then incorporating what ended up being like 3 or 4 layers of antihistamines to help the immune system calm down relative to this dairy thing. By the last time I saw him, he was like, I haven't had any problem since before the last time I saw you. And before then, it was like maybe one minor episode. And so last I heard, he had moved back to school when right after I saw him last. So it was like beginning of August last time I saw him, and he was like, "Dude, I have never felt this good in my entire life." And
Well,
gave him, I think the last day I gave him maybe just some pancreatrophin from Standard Process to just wrap up some healing that was testing off the pancreas. Um, Not something I see very often, but often off the gallbladder, for example, or like ovaries, something like that. You'll find that you'll have chemical offenders to it. But then from there, once you detoxify those or deal with those, get rid of them, you'll need to support healing of the organ with some sort of glandular supplement that is basically just tissue for that organ. With the gallbladder, you'll often have to incorporate nutrients that help replenish bile, or just straight bile replacement. Or, with like the ovaries, I'll give out a ton of obitrophin. Pancreatrophin will happen here and there. Spleen PMG, thymus PMG. Those are all really, really good immune system glandulars. Those will often test. But with this guy, I mean, he was feeling absolutely awesome at the end, and just gave him that to wrap up some healing. And I hope that once he finished those out, all is good with the pancreas, and that I don't hear a whole lot. But yeah, it's just the craziest thing. I'm like, why is it that the upper GI organs and food sensitivities or hormone issues affect them so aggressively to the point where I'm seeing a ton of patients that have weird symptoms? And we'll get into more about the girl with the left-sided neuro symptoms, but same thing. It's like the left-sided stuff, or feeling like you're going to pass out, or dizziness like this guy had. It's just, why would your gallbladder cause that? But I've been seeing it a lot. So if you know that you're doing a lot of carbs in isolation, and you've got some hormone issues, and you just don't feel right, dizziness or headaches or some sort of weird, I guess head type complaints, could be your gallbladder. And I've been seeing it more and more recently, so I'm not sure what it is. But anyway, yeah, that's that kid. So if you have a known problem with dairy, don't do it. And dizziness and things like that, and weird central nervous system stuff could be your gallbladder. Yeah, what are your thoughts on that, Dr. Joel? Because I kind of have some ideas in regards to where that connection is. But I'd be curious to hear what your thought process would be behind insulin contributing to a lot of central nervous system or brain dysfunction.
Yeah. In a lot of ways, I think we have so much knowledge and information on how the body functions. And in so many ways, I feel like we have no idea.
Yeah. Yeah, I agree.
And it's one of those things, the more that you study something, the more you realize you don't know anything about it. And
what do they call that? The Dunning-Kruger effect?
Is it? Okay.
Yeah, where it's the graph of when you know nothing, you know nothing, but then as soon as you learn a little, you think you know everything. And then as soon as you learn a little bit more, you're like, oh crap, I don't know anything. And you crash below knowing nothing. And then you slowly, as you master it, starts to creep up again. But I often feel like that. You're spot on with that.
Yeah, it's a good place to be as far as like humility and so forth. But yeah, I think there's so many things, it's like, just like when a lot of times, like, I don't know, we'll test somebody with autoimmune issues or hormone imbalances or whatever it is. And a lot of times like stuff will go back to the gut health. And so I think there's even so many intricacies within the gut health and with the microbiome, and the different bacteria and the different cells, and that it's a complete system. When we kind of look outside at, the environment, you have so many different factors, so many different species, so many different animals, so many different germs that help the environment and the ecosystem function properly. And it's like the same thing in our gut health. And I think there's just, we know some, but it's like, there's still so much more. So when it comes to the human body, I mean, insulin's interesting, right? Because insulin, we often think of, it just impacts, it's just related to your blood sugar. Yet there's receptor sites on the gallbladder that they found for insulin. And that's interesting. It's like, why would there be receptors for insulin on the gallbladder? Well, insulin is, at its core, it's a huge part of getting energy for our cells, taking the glucose molecules, the sugar molecules into our cells. And obviously our central nervous system, is going to largely use sugars and glucose and things like that. So there's a number of different factors. I don't know all the intricacies, but I could definitely see there being some sort of strong relationship. As you're talking about the dairy, I've had a lot of people like that too with different foods, where it's like I'll eat something, but they're like they don't have a significant reaction like immediately. It's more of like, with allergies, I tell people there's allergies and sensitivities. With allergies, you react to it very quickly, like within an hour. You have hives pop up, your throat swells, that kind of stuff. With sensitivities, it's more like you have a little bit of inflammation the next day. And for somebody that always lives in a state of inflammation, then it's no different for them. They just stay feeling terrible. And so a lot of times I'll see that be the case, whether it's gluten or dairy or coffee or chocolate or whatever. And then like you said, one of the things that I try to explain to people is when you have that inflammation response, it's one thing to stop eating the food, which will essentially, it's like you're not throwing gas on the fire anymore. So you let up the pressure there, but there's so many factors that contribute to how quickly is that inflammation naturally going to come down. And on its own, I mean, it could take 2 or 3 months for a lot of the patients that we'll see because they're in really rough shape. But when you have the nutrient support, high amounts of vitamin C like camu, using quercetin, things like that, it'll come down significantly. But it definitely takes those two things. You got to stop throwing the gas on the fire, and you got to support the body as well with that. So definitely good stuff. Lots of good stuff.
Yeah, I agree.
Cool.
But yeah, walk us through your clinical case you got on your list.
Yeah, I might go through a couple, but so let's start with I'll probably go through. Yeah, we'll go here. So, all right. So a patient, a lot of thyroid cases, a lot of thyroid patients. I know our patients love talking about the thyroid. We got a lot of people with weight gain issues and metabolism issues, fatigue, brain fog, dry skin, hormone imbalances, all these things. And so when we talk about the thyroid, there's a number of cases we talk about, right? We talk about hypothyroid, people that have low thyroid hormones. We have talked about how we've been able to help patients with that all the time. Hyperthyroid, where patients have too much thyroid hormone. Hashimoto's, which is an autoimmune condition with the thyroid. So we've talked about all these things. We've seen great results with all these things. This case is one of the cases that I think, honestly, there's a lot of thyroid cases. They don't tend to get better in our standard healthcare system. Whether you have too little hormone, whether you have an autoimmune condition, you still get prescribed a synthetic thyroid hormone instead of actually helping your body to heal itself. In this situation, this patient had a hyperthyroid condition where basically her thyroid hormone was too high. And when that happens, you get heart palpitations, you get hot, you get sweaty, you're anxious, stressed, all these things because your system is ramped up. One of the common things with hyperthyroidism usually goes back to one of two things. It usually goes back to either autoimmune condition called Graves', where your immune system attacks your thyroid, but that actually upregulates the thyroid, so it makes more thyroid hormone. She had testing for that by the time she came in. She didn't have that. But they did an ultrasound. They found nodules. So nodules are these little things, little growths on the thyroid. And a lot of times they will upregulate the thyroid and cause it to produce more and more hormone. Well, we found that we had her labs when she came in the first day. And so we just kind of jumped into things with the muscle testing and started figuring out where all this comes from. Thyroid nodules, Dr. Tim, I don't know if you've heard this or I've shared this with you, but a lot of times I find that they're just caused by viruses. Like I've helped, this is just one case. I've helped multiple people get rid of their nodules on their thyroid, like get rid of them. Either we're in the process right now of shrinking them with at least one patient that comes to mind, or we've actually gotten rid of them fully. And in this case, that was one of those. So she was on some different meds to try to suppress the thyroid. We found that there were some viruses that were going on. We addressed those with some herbs, supported some things with the immune system. I'd have to look back at some of the herbs and things, but everybody's a little bit different. So I don't focus so much on the exact herb because it might not work for the next person. But we worked through those things, and I think it was by just for like big picture with things. I think it was visit 5. She came in, she said, "Hey, the ultrasound results came back. The nodules are gone." And at this point, she was feeling a lot better. She still had a little bit of some like palpitations and stuff. And I think a lot of that went back to helping the body just overall support detoxing of these stress hormones and things like that. But her thyroid nodules are gone. Ultrasound came back negative. The nodules are gone. Pretty cool. It's pretty exciting. It was really exciting.
That is huge, especially when you can get some sort of like imaging done that confirms beyond them just feeling great.
Yeah.
And labs also improving. Seeing nodules go away or stuff like that is just it's awesome. It's makes you feel good that you're truly really really helping people.
It's so fun. And it's one of those things, like a lot of the cases we see, obviously not every case is like a home run hit, right? A lot of cases, I was thinking about this as you were chatting earlier, a lot of cases that we see, it's just, we got to get in the trenches. We got to do the work. Day after day, week after week, we got to eat better. We got to take different supplements if we need them. We've got to work on our lifestyle, stress management, movement, all these different things. And when you do that day after day, week after week, that's how you strengthen. That's how you heal. That's how you grow. Obviously, these episodes are about some of the more intense ones, more interesting ones, more exciting ones. But I would say like 90 to 95% of cases, a lot of times it's just the slow work and the slow growth. And that's what builds lasting results, I would say. But some of these cases are definitely fun to talk about. And I just looked up this note. She had 3 nodules. There was 2 on the right side of her thyroid and then 1 on the left. And these were actually found back in 2023. So she'd had them for a little bit. So that's one case. Any other thoughts on that? Otherwise, I might jump to another fairly quick one here.
Real quick, I haven't really noticed the correlation between viruses and nodules, but I do often find viral things when people have chronic primary thyroid issues. So when you work through all the inflammatory drivers and detox issues and things like that, that will cause your immune system to be skewed, especially in Graves' disease or Hashimoto's. I'll often find that you need to directly address the thyroid. And when that's the case, I will find viruses quite a bit. I find caffeine a lot too, like methylation issues will contribute to a lot of like, it's often the last piece that we really need to deal with a lot of people with thyroid stuff is just replenishing methyl donors.
Yes.
And avoiding caffeine. So
yes,
I find
that's huge. That's huge. Dr. Tim, I know you do awesome work. I bet you find stuff. I probably do too. I bet you find stuff that you don't even realize is there. You know what I mean?
Oh yeah. Like correlations between things that you're like, oh yeah. It's
like how many patients come in with thyroid issues and viruses, but they haven't had an ultrasound and they probably have nodules on their thyroid. It's just an interesting thing to think about.
Yeah, exactly. That's kind of the thing is in that circumstance, she had testing prior. And it's not like if somebody comes into our office that we're gonna be like, hey, let's run all of these other diagnostic tests because it's just not necessary in our opinion.
Yeah, totally. Every case is
resources when it's not going to change what we do moving forward. As long as full-blown pathology has been ruled out by their medical doctor or whatever, we basically just step in and do all the natural stuff. And with that being the case, why would we say, hey, get an ultrasound? Because they've usually already had one. Or if they've had all their blood work and their doctor's like, oh, that's all we need to do for you. Just take this medication forever. They're like, okay, well, screw that. I'm not doing that. And that's where we step in. So it's not important at that point. I mean, it's cool to see, but just for the sake of it being cool to see doesn't mean that it justifies them paying the money for an ultrasound just so we can be like, oh yeah, cool, we got rid of those nodules,
Yeah, totally. It's amazing. All right. Yes, absolutely. All right, Dr. Tim, do you want to go with another one, or should I go with another one here real quick?
I'll go through another one.
Cool.
I think that sounds good. Next one on the list here. Let's talk about the left-sided tingling. So this patient, she is in the textbook category of what I typically describe as the PCOS category that comes into my office. So textbook PCOS is characterized by, of course, female. I think it's, what do they say, like the 3 Fs? Does that go with PCOS? Female, fat, and 40 or something like that, which but
yeah, I think so.
regardless, typically textbook PCOS patient is overweight, diabetic, insulin resistant, all those things, versus the PCOS patients or patients that come into my office that are more so having insulin / testosterone issues and irregular cycles that maybe haven't gotten a definitive diagnosis of PCOS, but technically meet the criteria to be diagnosed with that. They're often just petite young women that just don't eat enough protein and fat and eat way too many carbs all at once. So I like to describe them as they're the low all the time blood sugar, and then all of a sudden, bam, they get these huge surges of blood sugar and a ton of insulin that kicks in. And the reason that happens is because there's just not a great emphasis on protein and fat, or their snack choices are like just chips or just a banana or something like that just causes a huge spike in blood sugar. So with that being the case, very often I will see young women who have fertility issues, irregular cycles, headaches, migraines, all sorts of more standard symptoms that end up being rooted in either liver detoxification issues due to cortisol, testosterone, things like that, or gallbladder issues tied to insulin. And usually those things go hand in hand, where one will test off of one, the other will test off the other. But if there are headaches or migraines or dizziness or things like that, oftentimes I will see it test off the gallbladder, or test to be rooted in gallbladder dysfunction, just like the guy I was just talking about with the pancreas and dairy issue. So anyway, this patient, we chatted on the phone, and she is actually a physical therapist. And she was like, yeah, we've gone through like all these different tests. We've tried doing treatment for, different like nerve root things and just all this stuff to try to figure out why she has this just left-sided neuro stuff going on. And she's like, nobody really knows. And she got some imaging done and nothing really showed up. And she's like, well, what am I supposed to do? I believe it was CT, MRI, something like that. But either way, I mean, checking for brain lesions and all that stuff. And it's like, okay, well, there's nothing. So you're okay. It's like, well, okay. Yeah, pathologically fine. No full-blown things that need to be surgically removed or significant problems or brain lesions and all that stuff. But clearly there's some sort of issue going on, anyway, so ended up coming in. We chatted on the phone beforehand, and I was like, look, it just sounds like it's probably this gallbladder thing that I've been seeing a lot of lately, where insulin issues, not eating enough, all this. And, it cracks me up because the answer that I get to that is always, well, I eat good. And it's like, it's this point of, I'm doing good. It can't be that, and it's just kind of funny because quality does not mean that you're getting the right quantity, and when it comes to food, quality and quantity are important. But for the sake of overall metabolic health, I am more so in the category of thinking that quantity is more important than quality in regards to like organic versus not organic foods, things like that. As far as it goes, food sources and proteins versus fats versus carbs, yes, quality. If you're looking at quality as a measure of macronutrients and how good your meals meet the criteria of 35 grams of protein, 30 grams of fat, all that stuff that we always talk about, yes, quality is important in that regard. But when you're talking like organic versus inorganic, or like, if in a pinch you need to grab some fast food or something, I am more so like, hey, if you got to run a Chipotle or you got to go someplace, even if it's like Chick-fil-A, if you are getting the macros that you need, yeah, a little bit of trans fat here and there is not going to kill you if your problem is just you're not fueling your body properly.
Yep.
I could honestly care less about a little bit of trans fat if you're basically starving yourself and getting these giant blood sugar spikes contributing to a weird dysautonomic issue or a weird central nervous system issue. Of course, in an ideal world, everybody would eat perfect, organic, all the things, and eat the right things, the right time, all the stuff, right amounts. But that's just not. If somebody comes in and they say, hey, let's fix my problem, I'm not going to say, hey, let's restrict a ton of stuff and make it more difficult for you to fix it when we can just worry about quantity for a little bit. So anyway, with that being said, ended up finding same thing, indicators for vagus nerve, indicators for brain, all these things, and they funneled towards just being a gallbladder thing, insulin issues, reworked eating. She kept a journal of when she was getting those symptoms. When the next time I saw her, she was like, "Man, I haven't felt this good in like months." And just slowly started progressing. And I believe the last time I saw her, she had like a single minor episode or two that was way smaller than it was before, lasted way shorter. And I was supposed to see her for another follow-up after that, but she called. I told her often what I will say to patients who you can just gather they're like, "Hey, fix my problem, send me on my way," kind of thing. I'll say, "Hey, if you get through this visit and you do these things and take these things and you don't have any symptoms anymore, just give me a call. Let us know. We'll just cancel your appointment. And if it ends up coming back, just let me know."
Yeah.
And she ended up doing that. She called and was like, "I have no problems. I'm good."
Love those calls.
And so I'm like, okay, well, I mean, I get to go home early, which is nice. And also, you're doing great. And so that's also nice. So I really hope that to this day she's feeling really, really good and that the issue is totally resolved. I didn't chat with her directly to confirm that for certain. But still, insulin with gallbladder. I mean, the glucuronic acid and the whole glucuronidation pathway in the liver is so incredibly important in keeping your gallbladder healthy and making sure that you're not bogging it down with all of these hormones. And where I think this connection is whenever you have insulin issues off the gallbladder, insulin and cortisol, all of the hormones required to regulate blood sugar, they're going to stress your autonomic nervous system. It's going to cause it to constantly have to regulate fight or flight versus your rest and digest. And of all organs that have to detoxify byproducts of everything that your body is doing, gallbladder is very, very high on that list. And so whenever you have to produce a ton of these hormones, if you get that bottleneck and you're not making good bile, it's just this positive feedback loop of chronic stress, and then you can't clear it out. So it gets worse and worse and worse. And so it just kind of snowballs. Then from there, you can't detoxify hormones and the body just goes, "I don't know what to do. I'm just going to be stressed all the time." And then from there, autonomic nervous system continuously is disrupted. So seems to be the case so far. I could get kind of more on a soapbox with that, but we'll just leave it at that for now.
Okay.
But both of the things today that I wanted to get to, or both of the two cases that I primarily wanted to get to, still gallbladder with insulin ended up coming up. So
awesome. Love it.
Last one you want to get to?
Yeah. I might jump through because I've mentioned some athletes, so I might have to share some of these more just like on my Instagram or something. But
we could do another episode. Part three. We've done part threes before,
baby. We have. All right. Yeah, I know we're running out of time here as well. So I'll do this one and then we'll get rolling into our day. So this patient, irritable bowel syndrome, basically every morning would wake up. He'd have this gentleman, I think he was like 20. He was like 25 or 27 years old. He would wake up every morning. He'd have 3 bouts of diarrhea before going into work. And every morning. And he just kind of had figured he'd have to live with this. I think it had been this way for like 4 or 5 years or something like that. And he just figured he just had to live this way. And this is just how it had to be. And it was such I love doing this with patients. It was such a cool opportunity to tell him, no, it doesn't have to be this way for the rest of your life. And I think part of the reason he thought it was just going to be that way was because the doctors that he had seen previously, like a while ago, like they didn't really know what to do. They didn't really know how to help him, and whatever recommendations or prescriptions they give didn't really help that much. And so he tried some things and then just it was kind of like, well, I guess this is just how it is. And so it was really cool to be able to step in and say, hey, that's not how it has to be. Like your body wants to heal itself and it can heal itself. We just need to give it the things that it needs. So we jumped in and after our first visit, he came back for the second visit. I said, hey, how's your gut health? How's the bowel movements? He said, I'm no longer having diarrhea every morning, like at all, like none, no diarrhea every morning. And I was like, awesome. That's
Sweet.
great. I know. Sweet.
Cool.
I love it. And
was
it's
that
funny.
For one visit?
That's literally one visit.
Isn't that the coolest thing where you're like, oh, Nice.
Well, it's humbling, right? Because it's like how many people, and I'm going to get into what we found and stuff, but it's like how many people actually have these health issues for years and years and years. And whether they talk to certain doctors or research whatever online, a lot of the times they're told, "Oh, this is just how it is. You can't heal from this. It's just how it's going to be." And literally, all it took was a little bit of faith, a little bit of doing some hard work, and actually figuring out kind of analyzing what's going on here, understanding kind of what the body is doing, and then having the right solution. And then, boom, the body's like, thank you. Thank you very much. So, what it looked like, one of his issues was he was drinking a couple cups of coffee in the morning. Obviously, those will move the bowels. So, I think from a general standpoint, if you're having issues with like loose stools and diarrhea and stuff, like, and you're drinking a lot of coffee, try taking a break from the coffee because usually that's going to increase motility. But what we found was a massive fungus issue, like like the way it's testing is significant fungus infection with the gut, and then he also had parasites as well. But the thing about the fungus was that there was different things, I think a lot of things with his nutrition and his diet that were feeding that fungus. And I actually think there was something about his coffee that either had mold in it or was somehow impacting that fungus, because I was seeing some kind of correlation with them testing that the coffee was actually making the fungus worse. And then I think he had a dairy sensitivity as well, which, man, this guy was, hitting, 1,000% here between the coffee and then the creamer in the coffee and all the things. So basically we did some herbs for the fungus in the gut. We talked about a low FODMAP diet and avoiding some of these specific foods that we were able to identify between the dairy and between the coffee. And literally within a week, like no more diarrhea every morning. It was really, really cool. So this was a patient back in Kansas in my practice that I first had in Kansas. And I haven't really kept up with them. I'd love to kind of hear how things are going, but hopefully things have continued to go well. So interesting case. IBS, Dr. Tim, we see that case all the time. It's one of those cases that doctors are like, yeah, we don't really know, try this. And sometimes the recommendation can be supportive, sometimes doesn't help that much. And so understanding that IBS is really just a list of symptoms, but understanding that it's usually driven by gut infections is huge. And if you can understand how infections work, what herbs are needed for the immune system, what nutritional changes are needed, and things like that, these conditions and diagnoses are very, very possible for your body to heal with them and so forth. So, yeah, that guy's life has changed. That's so exciting to me. Like just thinking about that. Like if I put myself in his shoes, which I know we do that all the time, Dr. Tim, is like putting ourselves in other people's shoes of like, man, like to live with that, right? I know you've talked, and it's so evident, Dr. Tim, to see like your compassion for people, but it's like someone comes in, they're in pain, they've got this throwing up issue, they've been this, they've had that, and it's just like, man, like I've dealt with health stuff before. It sucks. Like, I'm sorry. Now let's figure out what we need to do to fix this. It's so fun. I love getting to do that for people. I love it.
What it makes me think about is what would you and I do if we were not in this line of work, with some health stuff that we've had along the way. I have absolutely zero idea where my health would be if I did not know about this type of healthcare. I would probably be on all kinds of medications and have insane problems currently. So very thankful that we do what we do. Very thankful that we can do what we do to help other people.
Yeah.
Try to achieve better health. Like we can help ourselves continuously just because this is what we do.
Yeah.
Our families should also be thankful because we can help them too. I know my mom is. My mom's like, I don't know what I'd do if it wasn't for you and your sister.
I know. They had told my mom she had some pain on the right side of her abdomen. They told her she needed to have her gallbladder removed. This was like 6 years ago, I think, 5 years ago maybe. And I was just learning about muscle testing, learning about herbs. I was still in school, but I would come home on break and stuff and check around things. And I honestly don't even remember what I found. And I don't even think my muscle testing was that good, but I found she needed a couple of herbs. I was like, Mom, I think you need these. Take these. I'd literally been at school for like maybe half a year or something. And she took the herbs, her pain went away. And praise God, she actually went to one of the gallbladder surgeons, after a referral, and the surgeon was like, it's not your gallbladder. And I'm so thankful for that, because I can't tell you how many times surgeons will push it.
Yep.
And so we were able to save a gallbladder there. But
It's awesome.
Yeah.
Good
All right.
stuff.
Dr. Tim, we've got to get going here. So let's go ahead and wrap up, and we'll talk about doing a part 3 potentially here. So my name's Dr. Joel Miller. The practice is called Freedom Health and Wellness here in the Dallas, Texas area. We're in Flower Mound, Texas. You can find us online at drjoelmiller.com. If you have any questions, our office contact is on there. Feel free to give us a call or a text. Would be happy to help out in any way, whether it's questions about your health issues or trying to get some guidance or trying to find a good doctor, whatever it is, happy to help. And then feel free to find us on Instagram as well. It's just Joel Miller. Would be happy to help as well there. All right, Dr. Tim, how about yourself?
Awesome. I cannot talk. I am Dr. Tim Augustiniak down here in Bentonville, Arkansas at Flourish Functional Wellness Center. You can find me online at draugustiniak.com. That's draugustiniak.com or flourishfwc.com. If you go to those websites, I have links to all the socials as well as contact info on the homepage. So if you guys have any questions, comments, concerns, or suggestions for future episodes, feel free to reach out and let us know. If not, everybody, thank you so much for tuning in, and we will see you in the next one.
See you guys.